So if you have been recommended to have a mastectomy, we can build a new breast for you, and that's called a reconstruction. In this video, I'm going to be talking about one of those options, namely an implant-based reconstruction. Hi, my name is Dr Tasha and I'm a breast surgeon. As I mentioned earlier, if you have been recommended to have a mastectomy, in the UK at least, we can offer you some form of reconstruction. Now, not everybody would want to have a reconstruction, and actually a lot of women would prefer to go flat, and that's absolutely fine. You don't have to have any form of reconstruction if you do not want to. However, for those who do want a reconstruction, we have options for you. And in this video, I'm going to be talking about an implant-based reconstruction. Broadly speaking, we can do any form of reconstruction either in the immediate setting, which is at the same time as the cancer operation, or in the delayed setting, and that is after you have completed all your cancer treatment. So you'll have your mastectomy first and you'll go flat, and then about a year or any time in the future really, whenever you're ready, we can do a reconstruction for you. So one of the options is what we call an implant-based reconstruction, and that essentially uses an implant. So let's talk about, first of all, the timing of your reconstruction and what kind of implant you can use. Deciding the best reconstruction option for you will involve discussions between yourself and your surgeon. And there are quite a few factors that come into play, which will mean that perhaps one form of reconstruction may be better over another. And these include factors such as your lifestyle, your body weight, whether you smoke, whether you need treatments such as radiotherapy after your surgery. These are discussions you will need to have with your surgeon. Let's talk about the immediate reconstruction option. You will have a mastectomy, so the cancer operation will happen at the same time as the reconstruction. And there are two types of implant-based reconstructions that we can do. The first is a direct-to-implant reconstruction, and that essentially uses an implant such as this. So this is a silicone implant, and if you have a direct-to-implant reconstruction, then this implant will be placed either underneath your pectoralis major muscle, which is lifted off your chest wall, or it can actually also be placed underneath your skin above your pec major muscle. And if that's what's been recommended to you, then sometimes we will encapsulate this and cover this implant with either a mesh or a matrix. And we can talk about that in a different video. The other option is we use an expander implant. And what that does is, instead of using a permanent implant such as this, we use an expander implant, which is a deflated kind of implant. And this is an example of that. It's like a deflated ball, and this will be placed either underneath your pectoralis major muscle or on top of your pectoralis major muscle, and this depends on the surgeon's preference, and again, it's a discussion you will have. And then what will happen is, you can see there's a little kind of port here. You have this placed, and then you come to the clinic about once every 2 weeks, and we will inflate this through putting normal saline with a syringe and needle and inflate this to a size that you're happy with. Once you have that done, we'll take you back to theatre and replace this expander with a permanent implant. So that's using an expander is a two-stage implant reconstruction. This is another example of an expander implant with the port, but this is a separate port, which is a remote port, rather than it being attached to the implant itself. It's this little port here, and this will be buried underneath the skin a little bit away from the breast. This is usually a bit deflated. This has been inflated a little bit with some normal saline. This is what it would perhaps look like when it's flat, and this is what it would look like once it's inflated, and then this will then be replaced with a permanent implant such as this. This is silicone. It's quite squidgy and it's quite soft. So that is what will happen if you decide to have an immediate implant-based reconstruction. What happens if you decide to choose to have a delayed reconstruction? So first of all, you will have the mastectomy, so you will go flat. Then you will have any other treatment that you may need. Sometimes you will just go flat and you may not need any form of treatment, but 6 months, 12 months, or years down the line, you may then choose to have a reconstruction. If you have a delayed reconstruction, your chest will be flat, and so When it comes to putting an implant, it would be very difficult to put this underneath the skin because your chest will be flat. We can't put this straight away, so we can't really do a direct to implant reconstruction. What we will have to do is put in one of these, so one of these expanders, either this one or this one. And what will happen is this will be placed underneath the skin, so you can imagine your chest will be flat. This will be placed either underneath pectoralis major muscle or underneath the skin, and then it'll be inflated every 2 weeks with normal saline. Once you're happy with the size, then this will be removed and we will then replace it with an implant such as this. So that is what will happen if you choose a delayed reconstruction. I hope this has been helpful. Leave any questions in the comments and I'll see you in the next one. Take care.